Hello, everybody. Welcome to our medical interview today with Professor Mertens from Hirslanden Hospital in Zurich. Thank you, Professor, for joining.
Thank you, Peter. It's a pleasure to be here.
Today, we will talk about pancreatic cancer. Not an easy topic. Can you maybe let us know what is the number one symptom of pancreatic cancer?
So the most frequent and let's say most classical symptoms of pancreatic cancer is sudden onset of jaundice. People will present to a doctor with a pain-free yellow skin, which is basically the textbook way of presentation. This is depending. I think it's important to understand that the symptoms a patient presents with very much depend on the location of the pancreatic cancer in the pancreas.
Okay.
So if you think about the pancreas as a little sort of sausage-shaped organ in the middle of our abdomen, and through this organ, different vessels run, then what you can understand is if there is a tumor growing in the very tip of this organ, this is the part where the most of the ducts and the vessels run through, this tumor will start narrowing and compressing those ducts, and that leads to the yellow coloration of the skin and the eyes and the yellow coloration of urine, because that's when the bile fluid can't really run through anymore, and it will be basically a compression effect of the cancer. So generally speaking, cancers of the head of the pancreas, the first part, often present with this jaundice, with turning yellow. Pancreatic cancers that are further, to the side, to the other end of the pancreas, are more difficult to find. There is often unspecific abdominal symptoms. Patients will present with a general feeling of unwellness, a certain feeling of fullness, a certain, pressure sensation in the abdomen. And this often combined with a loss in appetite, with a substantial weight loss, with a general, malaise and fatigue symptom. But again, these are more subtle. If you have someone with a pancreatic head tumor, these patients, when they present, yellow, that's a pretty clear sign. If you have someone with these more subtle symptoms, it requires a bit more of attention to actually scan for it and then potentially find it at an early stage.
And is there any way to avoid pancreas cancer?
Well, we know there are certain risk factors for pancreatic cancer that have been very clearly identified. Number one risk factor that comes in mind is smoking. Smoking is well known to be associated with pancreatic cancer development. Chronic inflammations of the pancreas are known to be associated. So if someone knows that he or she has had pancreatic inflammation, so-called pancreatitis in the past, this may come with an increased risk for pancreatic cancer development. So if we know there is a history, then we are more aware. I think these are the most important factors. Stop the smoking. And be aware of previous diseases that may have affected the pancreas.
And now the most important question: can it be cured?
It can be cured. So, message of hope. The crucial part in this hopeful message is that finding it early is key to cure. And this is true for all cancers, but particularly true for pancreatic cancer, because pancreatic cancer is so centrally located that it affects so many structures around it, that this makes really often the main and then the subsequent problem. If we can find a pancreatic cancer at a very early stage by imaging, by early, and good examination, then the chances of healing are substantial. The more advanced, the more difficult this becomes.
So screening is key.
Screening is difficult because we don't have a very good clear-cut screening population. But I think clinical awareness and thinking of it when someone presents with, even mild symptoms is something that should be in the back of our heads. There is no established screening for pancreatic cancer in the general population because it's a rare cancer. Fortunately, it's a rare cancer. But we may have risk populations where we should, intensify or do screening, intensify surveillance. And clearly, if there are any symptoms that point into the direction, I'd be more leaning to rather do an imaging than just, push it on the side and keep going for another half a year. Because in pancreatic cancer, shorter periods of time mean a great difference.
Professor Mertens, thank you so much. I know you have a busy schedule, so we will end here. Thank you for talking about pancreatic cancer, and I wish you a wonderful day. Thank you. Bye.
Thank you, Peter. Thanks.